of you are from Aurora, and she completed her Bachelor of Science at the University of Guelph, and then went on to graduate from the Ontario Veterinary College in 2014. She completed her final year rotations in the mixed animal stream, working with dogs, cats, cows, goats, horses, sheep, pigs, you name it, she worked with them. But ultimately, she decided to choose a career with small animals. And she worked 1 year in the emergency medicine. I'm sure she may share some stuff with us tonight about that experience. And then she settled in general practice at Stouffville Vet Clinic, where she practices still today. And Dr. Marie lives with her husband, Craig, and her Boston Terrier mama, who there she is right behind her. And their 20-year-old cat, Angie. So she's a good vet. Her cat's 20 years old. And they enjoy taking mama on hiking and kayaking adventures. So Dr. Marie also loves to bake homemade pies, and that's her new specialty. So I've had the pleasure of having Dr. Marie as a vet for my animals, and she's wonderful, knowledgeable, caring, and kind. I'm thrilled to have her on the call today. And so welcome, Dr. Marie Ashbourne. Okay. Yay.
Thank you, Corey, for that awesome intro.
Okay, no problem. So that was Dr. Marie's intro, but we want to hear who you are too. So what we're going to ask you to do is just quickly say your name, your dog's name, your breed of your dog, and where you're from. So I'll let Tina kind of point out everybody's name.
Sure.
Okay.
Why don't we start with Elizabeth? Elizabeth, what's your... you just have to unmute. So if you're on a computer, you can scroll down to the bottom.
Sorry, yes.
There you go.
Okay, I live in Bottom-Craig, but in about 3 weeks, we will move to Aurora, to the Aurora Meadows. We have a new dog. Her name is Lily. She is 6 years old, and she was actually a breeder dog. And we got her from Schönberg. This is where the breeder is. And she is a very sweet and lovable dog, and she is very, very attached to us. And since I'm totally new to a dog, I never had any animals in my, well, I shouldn't say, when my kids were teenagers, we had a cat. But I did not grow up with animals. So for me, it's totally new. And when Lily behaves a little bit different, I'm worried right away. And I think, my gosh, is that right? What's wrong with her? And so tomorrow we actually go to a clinic close to Orangeville because she's getting neutered. Is that what it's called? Yeah, so she has a little operation tomorrow. Okay. So I don't know how it will be after that.
Well, it's a great conversation, Elizabeth, because we will be talking about neutering and spaying.
We will be talking about neutering and spay for sure. So welcome. All right, great.
I will listen. Okay, thank you very much for listening.
Thank you.
Okay, thank you, Elizabeth. Over to Barb.
Oh, okay. My name is Barbara. I have my dog's name is Hunter, and he's 11 years old. He's a mixed Bichon Poodle, and I'm quite proud of him because he's part of the St. John's Ambulance Team Therapy Dog Program, and he just loves visiting people, whether they're seniors or whether they're youngsters. He just loves enjoying and having them pet him.
Okay, great.
Awesome. Okay, over to Leslie.
Sorry, I lost you guys.
You're back.
Yep, I'm Leslie. Stouffville is my vet. Marie, I think you took care of Murphy when he had a cold just recently. He's a ragdoll, right?
That's right.
But I have a golden retriever. She's 9 months old today. Her name's Sadie, and she's getting into her adolescence, and she has been spayed.
Excellent. Very
awesome. Good. Okay, Andrea, over to you.
Hi, I'm Andrea. I have Daisy. She's almost 5 months, and she's an Australian Shepherd Pyrenees mix. And I'll give you, oh, actually, someone's home. That's her. And we're from Barrie.
Great. Awesome. Okay, Jillian.
Hi, I'm Jillian. My dog is Herman. kind of there. He's, I don't know much about him. He's a 8-ish and a husky shepherd, maybe. The last couple of years, I've struggled with incontinence for him, which seemed to be triggered by him eating snow in the winter, but then never fully went away. And now it's just something that I guess he consistently has. And we are from Port Perry.
Great.
Yeah,
Thanks.
definitely.
Awesome. Thanks.
It's a topic we're going to get at, I think.
Yes.
Yeah. Yeah. Okay, Karen.
Hi, I'm Karen from Aurora. Here, both of my Muttz, Sasha, who's a schnoodle, and she also has incontinence. She's 11. And Muffin Man, he's here. And he's special, very special, because he was my mom's. And he's Yorkshire Terrier, Shih Tzu, Lhasa Apso mix. And he's also 11.
Great.
So,
Okay.
Awesome. Okay, and then we have Marcy.
Okay, hello. I have a cat that's 17, and I have a lab, Lacey, that's 6, and I have a golden retriever, Murphy, that's 2.
Great.
And I'm in Stouffville.
Great. Thanks, Marcy.
A full house.
Yeah.
And I think you have a friend in Mary who has multiple dogs too. Mary, do you want to introduce yourself and your dogs?
Did you say Mary?
Yes,
I
we did.
I did.
Sorry, I'm listening to you and I'm like, wait a minute.
That's me. I have lots of dogs. I'm Mary.
Dr. Marie knows me and all our Anyway, so we have Marble, who's the nice calm puppy. He's the Australian Shepherd Border Collie mix. And then we have Jasper, who's a little more crazy Australian Shepherd, red tri. He's 7. Marble's 2. And Onyx here, who's got his big head here, he's a Shepherd Lab, and he's close to Jasper's age, so 6, 7-ish. And we're in Stouffville too, because we go to Stouffville Vet as well.
Okay, great.
Well, Mary's daughter is one of our very talented technicians. So
Yes, the dogs are looking out the window watching for her walking home. So they might make noise soon.
That's okay. We can mute you. Or we can listen.
Okay.
Yeah, I can mute me.
Lily, do you want to introduce yourself and your dog?
Sure. Hi, I'm Lily. I'm in Stouffville. I've got 2 dogs, and I've been miscalculating their ages for the longest time. So just recently looked at their records, and I've got Bolt, who's an American Eskimo Australian Shepherd, and he's 9. And I'm finding he's got these fat deposits, and we call them wings. I'm not sure, but we're going to go see a vet maybe in July. I think I'm getting concerned. Sorry?
They're over his hips?
They're in his armpits.
Okay.
Weird. I don't know. I thought that they would go away when he lost some weight, but everyone always calls him fat, and I said he's fluffy. Then I've got a second dog named Smokey, and he's 10 years old. He's a Shih Tzu Schnauzer mix, and he's having issues with his teeth now. So I think we might need extractions.
Okay. All right. I think we're talking about a little bit about all this. Yeah. Mm-hmm. Awesome.
And then we have one more. I think we have Robin.
Robin, yeah.
Robin, are you okay unmuting to introduce yourself? If not, that's okay as well. Okay. Not sure I can.
Okay.
Okay. No problem.
Okay. Well, thank you, everybody, and welcome. Before we get into our poll, I just want to mention some of the things that are going to be coming up. Oh, there. We've got Robin, who has her collie mix, who's 40 years old. Okay. Thank you, Robin. So just so you know, some upcoming sessions are going to be dog nutrition and superfoods. That's our next one coming up. Then we are going to have canine acupressure. We're going to be having Jessie come on later in, I think, June. And then we have pet first aid We've got someone that instructs it going to be coming on and talking about a number of things. And then in August, I believe we've got the dog safety. So those are some of the upcoming topics, which all are of very good interest to us. So what we'd like to do now is break you up into groups. Oh no, we're going to do the poll first. So what we're going to do is a poll, and I'm going to have Tina instruct you on it again. So it's similar to what you do with the Q&A. Unmute.
I just launched it. You should see a note that comes up that
Yes.
says a poll was launched. If you didn't see that, go back to where the Q&A is. So the circle, the triangle, and the square. And you will see something that says polls. And you just click on the polls, and you should see a poll there.
And what we want you to do is select the main reason you visit your vet. So there's a number: vaccinations, neutering, spaying, dentistry, swallowed something, surgery, injury, wellness checks, illness.
It could be a combination of things, but
pick the one that most of the time you go for. And then you just have to, once you select it, select vote, and you'll see the answers come up.
Yeah, we're good. Okay, that's it. Everybody's voted.
Awesome. So it looks like vaccination and wellness checks are kind of tied. So we'll be talking about those today. So that's great. All right. So what we're going to do now, because we're not doing the breakout groups till later, I believe. So what we're going to do now is get Dr. Marie to share some of her experiences with us. So we want you to talk about some of your experiences as a vet and the main things you've seen from your patients.
No problem. So I guess like looking at the poll, I really like it because that's a really good summary of sort of what we see. I will certainly say that the 4 votes for vaccinations and 4 votes for wellness checks, we're seeing a lot of that lately because of a lot of people got pets during the pandemic, which is a really, really like that's a very nice thing. We all can agree that our pets are wonderful companions. So we are seeing a lot of new pets, both adopted as adults or people getting puppies or kittens. Other things, I was the only one who voted for swallowed something, and that's because I have a problem dog who loves to get into garbage. So that's the main reason I take her to work. But otherwise, the other things kind of seen here, I would say dentistry is probably one of the things that we're seeing the least of. I think that sometimes in my experience, sometimes we all kind of forget about our dog's teeth as part of their health. So daily brushing, and I'll get into that kind of a little bit later, but I think that that's something that would maybe be a good thing. Or if we all brush our dog's teeth, it'll, we won't see very many dentistries. But so veterinary experience, we've been pretty busy during the pandemic, just with lots of new additions. That's kind of it. I think I have, I had a question here. Should I get into some of the questions here, Corey, or?
Corey, you're on mute.
Sorry, I muted myself. So, okay. You know what, Marie, if you could just talk about symptoms for a second, because I think some people, I run the pet facility, and they sometimes think I'm a vet, and I get texts on the weekend and everything, and I'm like, okay, I'm not a vet, go to the emergency clinic immediately. So I think that some people aren't sure when to go or when to call a vet or what to do. So what are some of the symptoms that we should be worried about and definitely call the vet?
Yep, that's a really good question. So I made a little bit of a visual aid kind of PowerPoint. So I wasn't sure if you guys wanted to see me the whole time. So I'm just going to share my screen here just to kind of help us out. I do have an answer to that. Okay. There's also, I'm a pet owner myself, so can everyone see that?
So you press present now. On the bottom.
Oh no. Okay.
Okay.
Present now, and then your screen.
And then share screen. And then click on your screen. Click on your screen and it'll come up.
Okay. Can people see this now?
Nope.
Oh,
It's coming. Now it's coming. Patience. Okay, there we go. There's Mama.
Okay, good. I was gonna say through these visuals, I'm a pet owner myself, so there might be a shameless kind of bombardment of photos of my dog, but I think we all kind of are guilty of that. So definitely reasons when you should call the vet. I kind of put together 4 major reasons when, you know, you really shouldn't wait. You probably should get on it and start thinking about getting to a veterinarian, or at least picking up the phone and giving them a call. So 4 reasons. Number 1, if they're vomiting food or water, dogs will definitely, they can have like an acid reflux where they vomit bile or just the occasional spit up. That I'm less concerned about. But when we have, you know, they take down their food or they take down their water, it comes right back up. That's something that usually is a sign of an obstruction. And I feel in my experience, that's sort of something that kind of gets put on the back burner a little bit. You know, we'll see if they're okay tomorrow, or and the longer you leave those, the more problematic they can be to repair. So that's my number 1, is if we're vomiting up our food consistently and our water consistently. Another one, so unusual breathing or coughing. Kennel cough, I'm sure we've all probably heard of it. It's like a dry, hacking cough. It's a treatable problem, but it's pretty infectious, so good reason to go to a vet. And the older our dogs get, the more concerned I am about them having unusual breathing or coughing, because it can be a sign of a heart problem. And I also find that that's something that kind of maybe sometimes gets kind of, you know, we'll see if it improves with time, and it's something else that should be corrected. A big one is if they've eaten something. So we have a short window, actually. Dogs will empty their stomachs within 1 to 4 hours. And then once something passes from their stomach into their intestines, it's either absorbed, or if it's an object, we have to hope that they're going to pass it in their stool. If they eat something, whether it's a mitten or a sock, or if it's something like a toxin, like we eat chocolate, we eat raisins, grapes, onions, call us right away, because we do have a window there where we can induce vomiting and have them bring it back up and just eliminate it as a problem. So if they swallowed something, don't wait. Definitely call your veterinarian. The other one, I always I think that having your veterinarian's phone number handy, just in case, if you're ever worried and you're considering giving any kind of over-the-counter drugs or home remedies, veterinarians definitely, I can say on my end, I certainly don't mind if we get a phone call just asking if something is safe to give to a pet who may be uncomfortable. So just to give you an idea of why I think that's important, there are some products for human beings that are very safe for us, but quite toxic to our pets. So I put 2 examples here, Tylenol and Advil. This is particularly true of cats. It is true of dogs in reasonable sized doses. So that's kind of my 4th thing, is before you give anything over the counter, it never hurts to pick up your phone, give a call to your vet's office, and just make sure it's safe. I just included there, just for anyone's reference, animal poison control number, just in case anyone, it's a good resource in case your veterinarian's closed and you can't reach an emergency clinic. Really, really good resource in case your pet swallows something, as they always do. So those are kind of, I guess, my top reasons why I say definitely a good idea to go see a veterinarian. Did I just lose my screen? I think I did. You see me again. Okay.
Yeah. So you go down and you can present again.
Okay. Awesome. Yep. So those are kind of what those are my big 4, you know, vomiting, food and water, breathing, eating something.
All right. That's good. And I know from many of I had senior pets and the coughing happened and it was heart conditions, you know, and that's where I think sometimes I find, even with some of the owners that I know, you wait too long. And sometimes if you've waited too long, it's too late. And I'm not saying that it's mean, it gets into more and more. So, okay, that's excellent.
Yeah, it becomes harder to correct.
Yeah. And I guess a question that had come up too before, or we would like to know, is what has been some of your most unusual patient cases that you've seen? I mean, you worked in the emergency, and I know you work at the Stouffville Vet Clinic now. So what are some things that you've seen?
I've seen, I guess, kind of one of my favorite ones, one that always stands out. I was fairly new at the Stouffville Vet Clinic, and it was a dog. So the daughter had just recently started doing kind of like, I guess, a makeup routine. She'd always take a Q-tip and use the Q-tip, put it in the trash. What she wasn't aware of was that her 7-month-old border collie was sneaking in after she'd throw out that Q-tip and helping himself and taking those Q-tips. Over time, there was never a big box of Q-tip that was unaccounted for, but eventually they built, and it was during our Christmas party, actually, we had to go in and we had to surgically remove a soccer ball sized
Oh my goodness.
So that one always stands out because it's just, it was such a, it wasn't, he ate the box and we knew about it. It was just over time, just built up those Q-tips.
So they did not digest at all. They just, oh, wow.
Oh, yeah.
So I thought you were going to say that he had lipstick. He came in with
That's what I thought you said. They thought the dog was bleeding and it was lipstick.
We actually see, especially with our light colored dogs, when we see the dogs come in, I always have to think, I'm like, oh, is there a wound there? And it's, no, it's, he got a kiss from mom. He got a little lipstick.
Awesome. Okay. So what, one thing that's come up, and I am going to ask you this too, is why do dogs roll in yucky dead things?
I wish I had a good answer for that. I don't think it's fully understood by anybody. I know there was a theory thrown around at some points that, you know, it's a thing where the worse you smell, the less likely you are to get attraction by predators. Honestly, that no one really knows. I think it's kind of more on the side of a perfume sort of thing. Like, you know, you smell something that's interesting, why not smell like it? So I always kind of feel that that's it, but that's my best explanation.
Okay. All right. That's good. That's good. We'll take it. Okay. What we're going to do is a quick breakout now, and then we're going to come back and ask Dr. Marie some more questions. So what we're going to do, Tina's going to break you up into, how many groups are we breaking up into?
We are going to break out into 4 groups, or actually the 3 groups. And if you haven't, what's going to happen is I'm going to set up a room. I've set up the rooms, and you'll all automatically go into those rooms, and you'll have 3 other people in the room. If for some reason you get disconnected and it's not working, just dial back in, and you can stay in the main room with us. I know that there's 1 or 2 people that have issues. I think Leslie, you're one of them that has issues staying in the breakout room, so you'll stay in the main room with us.
Okay. And what we're going to ask you to discuss is the most unusual thing your pet has done that required a vet visit, and then we'll come back together in a few minutes. So let's take 5 minutes. So hopefully you had some good discussions there. We want to bring back some questions for Dr. Marie. So hopefully you all got to chat with each other and learn some interesting, unusual stories. So that's great that you got to meet some of the group. So Dr. Marie, let's talk about vaccinations, titer testing, fleas, and ticks. So I'm going to hand that over to you because we had a lot of questions like the vaccinations and titer testing. Maybe you can share some information with us on that.
Yeah, you'll just want to unmute yourself, Dr. Ashbourne.
Unmute yourself, Marie.
I don't know how I muted myself.
I think it automatically does. Yeah.
Yeah, all good.
Excellent. Okay, and can you see my screen?
We are going to see it in 2 seconds.
Okay. Good.
There we go. And then just do slut. Yeah, and then just do your, okay.
Good, okay. So I guess I'll just breeze through kind of a very quick kind of fun facts about what we actually vaccinate the dogs for. As a pet owner, like without having, you know, like I know the vaccines, I always think, you know, it's so important to know what we're actually vaccinating the dogs for and why they're a big deal. So I've broken it into just kind of what's bolded, 4 basic vaccines that we give our dogs. The first one is kind of a mouthful. So you probably recognize it on your dog's health passport as either the DHPP or DA2PP vaccine. And this is one that we give them. This is like, we give this puppies as young as 8 weeks old. This is their first puppy shot, and we end up continuing it every 2 years. I won't go through like the lengthy kind of details of all of them. I just kind of pulled out the 2 main diseases. There's 4 diseases, the 2 main ones that we're most concerned about with this vaccine. Distemper, everyone's heard a little bit about it. We've actually had quite a number of distemper infected raccoons in Stouffville and other parts of the GTA. You can kind of read there sort of what the symptoms are. The biggest problem is that with progression, it can turn into neurological symptoms, so dizziness, falling over, or actual impairment of their gait, or essentially the way they're walking, that can sometimes be permanent. Interesting, this vaccine or this virus is most closely related to human measles. So it's kind of the equivalent of trying to vaccinate your dog for measles, just like we do our children. The other disease of the DA2PP vaccine is parvovirus, is the next most important one. It's caught from other dogs and wildlife. And it can be quite serious. So life-threatening, bloody diarrhea, vomiting, dehydration. I would say in about 80% of puppies, we can see that it become life-threatening or fatal, which is very sad. So good to vaccinate for. Next, everyone knows a little bit about rabies. This is actually the only vaccine that's required by law in Ontario. So this is the one that veterinarians were obligated to be most emphatic about keeping up to date, just because it's required by law, because it's obviously a disease that humans can get. Leptospirosis, this is one that your veterinarian maybe would talk to you about if your dog drinks from standing water. So this is my very outdoorsy dogs. We go camping, cottaging. This is one that your veterinarian is going to be recommending to you. It's if wildlife urinate in standing water and our dogs come along, they drink from that standing water, they can get the disease and it causes kidney failure. This is also another one that's transmissible to human beings, so we can catch it from our dogs with it if we're not doing proper hand hygiene when we're walking them. And we do see quite a handful of cases of it each summer in Ontario. Lastly, kennel cough is or bordetella, caught from nose-to-nose contact with other dogs. So big thing for when we go to grooming parlors, doggy daycare, boarding facilities. It's a very treatable problem. They need antibiotics and they usually recover beautifully. It's just a very stubborn infection, and it's very contagious, which is why a lot of our boarding or doggy daycare facilities are very they'd like your dogs to have that vaccine. I'll talk quickly about titers. So what titers are is essentially when we measure the blood of the specific patient and we see, are there antibodies? So is their immune system producing an adequate protective response against the different viruses or bacteria that we vaccinate for? A question I get asked a lot is, where does the, 3-year, we say, example, rabies vaccine is good for 3 years in dogs, but, it helps to know where that 3-year label comes from. So I have my population of dogs here. What we do, the way that drug companies will assess how long a vaccine can last, they day one vaccinate everyone. 1 year later, they test everyone's blood, they titer them, and they see, are 80% of them still protected? If so, carry on to 2 years later, test their blood again. Are there still more than 80% of the population still protected? Once that population falls under 80%, they decide that that's when the vaccine needs to be boosted, and for rabies, it's a 3-year. So that's just a little background on what the idea of titers is. Titers, in my opinion, every dog in a perfect world, we do titers on all of them. And then we'd only be vaccinating them when it's truly required, when their titer falls below a protective level. So we're treating the patient, not just the population, based on, what was the recommendation of the vaccine duration of 3 years. The only problem with it is the cost. So cost of giving your dog a rabies vaccine is usually about $30 plus tax and consultation to see your vet. The cost of a rabies titer in Ontario is usually between $300 to $400 and up. So it's not a very cost-effective method, and the vaccines are so safe. So that's one reason why most owners will choose, and most veterinarians will promote, to vaccinate as opposed to doing titer testing. In dogs who have had episodes of vaccine reactions, or if there's some medical condition that precludes them from having vaccinations safely, we'll titer these dogs, and we do it every couple years. But that's kind of why it's not really the mainstream of why we don't do titers that often. I'm going to come back here. There we go. Okay. Did that kind of make sense? Yeah. Okay. It's a good question, because honestly, I think titers are great. Like, we should all be titering our dogs. It's just not exactly cost prohibitive. So.
Yeah. Okay. All right. Can you get into talking about, that's great information. I didn't know that about the rabies, why it was 3 years. So that's really, really good to know. Can we talk about flea and ticks? Because I know this is the season right now.
Yes, definitely is. You guys have probably, at least someone in this group, I'm sure, has found a tick on their dog already. Yeah. It's been really bad for ticks in the last couple of years in Ontario. We've seen them in months like I've found some on some dogs in January, which is super crazy. I put a picture here because something that I find is that most people, I will either you know, we can easily mistake a wart for a tick, or a tick for a wart. So I felt this might be a bit helpful to see this guy. Yeah. I actually don't know how to start presenting from.
So do slideshow up at the top.
Okay.
And then current slide. From current slide.
Yeah. Thank you. Okay. Awesome. So this is a picture of a tick. So this is a tick embedded into a dog's skin. What we have, so this is the body of the tick. You can kind of see little black legs kind of sticking out, and they bury their headpiece right into the skin. So this is what a tick looks like. It certainly can look like a wart or a cyst. If you have any doubts, don't try and remove it. Just try and get to a veterinarian. I know on my end, I certainly don't mind if owners snap a photo and send it to me before they start trying to pull it off, because we don't want to pull off cysts. But if you see those little legs moving around, you're definitely looking at a tick. There's lots of different products that can help us prevent fleas and ticks in Ontario. Most of them, your main two options are going to be oral medications, or you're going to have topical medications. So it's usually drops you put on the back of the neck, kind of like a repellent. Your veterinarian would be able to go over with you kind of which one would be best suited for your dog based on their lifestyle, and also any dietary allergies or aversions, may have. I did receive one question: is there a natural way to prevent fleas and ticks? Unfortunately, I wish I had a better answer to this too. Not to my knowledge. I know that citronella has been, that's kind of the closest thing that I would say to the most natural product. But honestly, I haven't seen a real true effectiveness of it in the really severe tick seasons like what we've been having. Otherwise, the only other natural preventative for fleas and ticks is avoidance, or doing tick surveillance. So avoidance, avoid areas of tall, unkempt grass is usually where our ticks like to hide, and in the very wooded areas. Obviously, we don't want to deprive our dogs of access to those places for exercise. So if you come back in, just do a nice little feel of your dog and make sure you haven't missed a tick, or you don't find a tick. If you do, I just kind of threw over here, like, you can buy these on Amazon. They're great. Tick twisters are fantastic for someone like me who is has a crippling fear of spiders, and ticks are a family of the spiders. They're really easy to use. You kind of sneak the teeth of the twister underneath, right at the base of the tick there, and you just gently twist, and the tick will release. The tick, everyone always kind of worries about, what if you leave the head piece of the tick into the dog? It's certainly not ideal, because leaving the head piece of the mouthpiece of the tick in the dog, it can cause infection, abscess. It can be uncomfortable. It's not ideal, but it's also not the end of the world. Don't panic if you think that you've left the mouthpiece of a tick in there. Just speak to your veterinarian about what could happen at the site there, but not the end of the world. I also had a question: what's the difference between tick treatment from Amazon versus the vet office? I guess what I will say about that is there are counterfeit products out there, and you do come across them occasionally, where the product can look identical, the packaging can look identical to what you'll see at your veterinary office. But unfortunately, it could just be a really, really expensive dog treat, and not actually contain any medicinal properties. So be careful where you're sourcing things. For convenience, a lot of veterinary offices have what's called My Vet Store, which is kind of like an online store where you can order these sorts of things from, and it's still sourced through the drug companies themselves that are reputable. So yeah.
Great. That's awesome. Okay. And actually, I was going to get into what your next slide said is. So can you talk about feeding schedules? Because I know some people have puppies, some have seniors, some have active dogs, non-active dogs. So give us some information on the time of days. I mean, I hear all different things.
Yep. So easy answer. It can sound complicated, but I'll just bring this up again here. So for feeding schedules, our biggest one that we want to pay attention to is our puppies, anytime that they're between 2 to 9 months of age. When they're young and they're still nursing from mom, they're doing that at roughly every 2 to 3 hours. So when we take them and we're putting them on hard food and we've weaned them away from mom, we kind of want to stay at more frequent meal schedules, just because they're coming off of every 2 to 3 hours. So we kind of still want to feed them slightly more frequently. So my recommendation for puppies is usually 3 to 4 times a day, just small, frequent meals. Depends on the size of your dog. It depends on the breed. I usually say, look at the packaging of whichever diet you choose to put them on. And that'll usually say the daily amount that they require. So the amount they require, they require, example, 1 cup of kibble per day. So then you'll want to break it up into 1/3 of a cup 3 times a day. So we're feeding them small meals 3 to 4 times daily. Our adult dogs, less critical. Some dogs love a lunchtime meal, and that's why I put 3 times daily, but they don't have to have it. You can do twice a day, and if you're giving treats in between, just make sure you're not over treating. Treats should never take up more than 10% of what we're feeding our dogs. And then I kind of put 2 geriatric dogs. Same thing as adult dogs applies. Just as long as they don't have any kind of nutritional needs or medical conditions, like they have acid reflux in the morning, that usually means they need to be fed later at night. That's kind of really the only prohibitive thing for a feeding schedule.
Okay. And we just got a question from Andrea there. Can you speak about changing diet? So some people will change dogs' food. So can you touch on that for a minute?
Definitely. So if the diet that you're feeding isn't working for your dog one way or another, it's just not agreeing with their tummy, it's not exactly a cost-friendly diet, and you want to switch to something else, just make sure you do it very gradually. I usually say for dogs about at least over the course of 1 week. So usually block off kind of, on the day that you want to start, do, a quarter portion of the new diet, 3/4 of the portion of the old diet. Do that for 2 days. On the next set of 2 days, do half and half. Next set, do 3/4 of the new diet, 1/4 of the old, and then you'll come to the 7th day where you're finally on just strictly on the new diet you want to be on.
Okay,
so
that's great.
Transition's key.
Okay, good. Excellent. So I think question 2 is the neutering and spaying. So when should I fix my dog? Risk if I do it early or wait too long? Does it help? I mean, I hear things with aggression, humping, marking, running away, so all that stuff.
Absolutely. I'm not sure if you can see this, just in case people want that visual. I included cats on here too, because you know, a lot of us are also cat owners. The easy answer for cats, 6 months of age. Our male cats will develop unwanted behaviors, usually spraying. Our females come into heat around 9 months of age. We don't want them to have that because it makes them very likely to develop breast cancer. So for that reason, in cats, whether you're male or female, we recommend 6 months of age. Dogs, it's a little more complicated. So the current thought is if you allow a dog to reach their full growth potential, which is going to occur at 10 months old, that's when they stop growing. If you allow them to reach that, they'll be less likely to develop joint issues when they're older. And that's been found to be true. The only problem is that with our females, so that's why I've put males 10 to 12 months if we can. Once they've stopped growing, you can neuter them, we're okay. There doesn't tend to be any kind of health effects to waiting that long. You certainly don't want to wait forever. Our females are a little complicated because our girls are going to come into heat on average. Their first heat's around 9 months of age. And the same thing that I said about cats does apply to our female dogs. Even if they're allowed just one heat, it does increase the chance of them developing breast cancer when they get older. They can also develop an infection in their uterus, which can be life-threatening, and we can also see the obvious unwanted pregnancy. So for females, I kind of make my recommendation a little younger. We're getting as close to that 10-month mark as we can, but not reaching that 9, so usually about 7 to 8 months old. Corey, you mentioned about does neutering and spaying and neutering help with behaviors, and I will say that definitely behaviorally, usually it's our boys that carry with them a little bit of the behavioral comments. So usually, yes, humping, marking, being territorial, being bossy or aggressive to other dogs. Yes, this does make a difference once you neuter them. You don't see the difference right away because testosterone is the hormone that's fueling that behavior and actually stays in their body for 60 days after you've neutered them. So you won't see that transition right away. It's also, you want to, be good with training as well, but it does help alleviate some of those behaviors.
Okay. Okay, that was great. I did have a question about the ticks that came from Mary. Are ticks attracted more to reddish brown dogs than other colors? We found ticks on our red tri several times, but not on the black and white dogs.
That's interesting. I would say that I've never heard that. Would the one dog, the red dog, be kind of more prone to going more adventurous into the bushes kind of thing?
No, they all go at the same time. I was just wondering if Jasper's deer colored.
I like that logic. Yeah.
Well, because when he was a puppy, he had one, and it's just walking the dogs. And then a few months back, when it was just getting warm, Jess found 3 on his back.
Oh my God.
And nobody else had any, so we're come home and we're stripping off everything and we're all jumping in the shower. So, but it's like, that's the only thing we could think of.
So Jillian thinks he's tastier.
I wonder.
I think that's a really good point, actually. It's just like Jillian said, mosquitoes, they prefer some people over others. No, I think that's probably a fair explanation.
Now, Tina, okay, I've got a few questions coming. Tina, you had asked, why do neutered dogs show aggression to unneutered dogs? And actually, Tina had asked, why do neutered dogs show aggression to unneutered dogs?
Okay, it's usually the opposite. It's usually the unneutered males, so the intact boys who have not been neutered, they usually show aggression toward the neutered males. The reason for that is they still do recognize that they are male, that they're not a female, but they do see them as competition. And again, all that behavior is fueled by testosterone. So by the fact that the testicles are still there making testosterone, they still exhibit that bossy behavior. They still recognize that they're boys, even if they're neutered.
Okay. All right. And then Leslie had asked, when should we switch a puppy to adult food?
Yeah, that's a good question. So I usually say once they've finished growing. So that, again, like I said, that's 10 months old. And that's also the time we can start switching them to the less frequent meals. So we can put them out to 2 meals a day instead of, say, if we were doing 3. Okay. And again, transition slowly.
Okay. And then Karen, I know this is going to bring up something else. Do we have to worry about mosquitoes? And that's the last question in the round.
For our dogs.
Yeah. Yeah.
For our dogs.
Yes.
Yes. Okay. Yes, we do. So mosquitoes, they're a nuisance to dogs just like they are to us. But the biggest reason we are concerned about mosquitoes with dogs is they can carry heartworm. Heartworm, we're extremely fortunate in Ontario that heartworm is not a common occurrence. However, it's more of a common thing in the southern states, the Caribbean. There is some of it in northern Ontario. The problem with heartworm is we're seeing more of it because dogs are getting rescued from abroad. So yes, we do worry about mosquitoes in that sense, that they carry that.
Okay, that's great. Awesome. Now, I know that some people had brought up at the beginning the incontinence and the trouble pooping and stuff. So can we just touch on that for a moment? That'll be kind of our last topic.
Definitely. Yep. So the incontinence, so kind of broke it up into pee and poop. And I'm sorry, I forgot. Was it Jillian whose dog had the incontinence? Nope. Oh, there's a couple. Okay.
There was a couple that.
Karen and
yes,
Lily, maybe?
Yeah, I had it.
Okay. So I hope this helps. If you have any questions, do let me know. So for the dogs with incontinence, here we go. Everyone can see. Good. Okay. So if your dog is having urinary issues, meaning they're having accidents in the house, they're not urinating where they should, there's usually a medical reason for it. It's less common, believe it or not, that it's behavioral. There's usually something underlying. I've broken it up into, based on your dog's age group, what would be the most likely problem or reason that they could have incontinence issues, that they are either having accidents or dribbling urine. Puppies and middle-aged dogs, it could very well just be a house training problem. In which case, it doesn't matter how old they are. You can always teach an old dog new tricks. Mama featured there when I adopted her at 7 years old. She was not house trained whatsoever. And now she's very on the ball and bulletproof. So you can teach an old dog new tricks, talk to your trainer, just get back to the basics of house training. Otherwise, for puppies and middle-aged dogs, if we have, it can be quite common to have a urinary tract infection or bladder crystals or stones. And sometimes that's something as simple as changing their diet. Geriatric dogs, so older dogs, all of the above can be true for them, but they're also more likely to have what's called true incontinence, where we can see this it's most common in our spayed older females where they actually dribble urine in their sleep. Our males can do it as well. Otherwise, if they're having accidents in the house, we can see things like kidney disease, diabetes, or different types of cancers and prostatic disease in unneutered males. So best advice for any dogs having accidents in the house, get a urine sample. We can tell a lot from a dog's urine. Sometimes we do have to see them in person, but bring a urine sample to your vet because it's super helpful. I've kind of put together a little thing about bowel movements too, and main reasons why I see dogs with bowel issues. Again, if they're pooping in the house, it may just be that they just, they didn't fully understand their house training, and it's never too late to get back to those basics and talk to your dog trainer about it. Dogs can also, the rest of these are kind of main reasons why you may see them have soft stools or pooping in the house, that urgency they need to go. Parasites, they can pick up parasites that live everywhere in our environment, including roundworms and hookworms. Snuff people food, sometimes we see dogs get into things that they shouldn't. There are infectious stomach bugs that are out and about, and that would apply more to the dogs where you just see on and off diarrhea or pooping in the house. It wouldn't necessarily be an everyday thing. Finally, dogs can have allergies, and again, like allergies kind of ties in with inflammatory bowel disease, IBD, which dogs do get. So excluding all of the medical reasons, it could just be house training. But again, your veterinarian would be able to look into that issue a bit more with you.
Okay, awesome. Awesome. Okay, well, thank you. I did have somebody a question. Where was that question that I saw there? I think it was, let me get it. Robin, is there something we can put on a dog's nose to protect from the sun? So that's, I guess we're getting in the hotter weather, so.
Yeah. So you can put things like Vaseline on dogs' noses to help keep them moist. Now, the only problem is they usually just lick it right off. So you can do your best, but that anything you put on the nose, they're going to try and lick off. But Vaseline is quite safe.
Okay, awesome. Okay, well, I'm looking at the time, and I just want to say thank you so much, Dr. Maria, and thank you for your time. Thank you for your expert advice and answering of the questions. I just want to get some input from you, or just if you can leave us with, you know, what can we do, one, to make the vet experience a little bit more welcoming for our dogs when we're taking it, and then what are you know, a couple tips that you can leave us with that we can do for the wellness preventative measures for our dogs to stay healthy.
Yeah, no problem. So I'll run through this very quick, but yeah, there are lots of things that you can do to try and help them with that. So obviously, you know, coming to the veterinarian can be very stressful. I kind of grouped dogs and cats a little differently here. Starting with dogs, like the waiting area is a very busy place with receptionists, other dogs, other cats. So creating kind of just an environment where it's just you and them. Positive reinforce, get them into those kind of familiar tricks that they know, get their mind working and focused on you. Looking at them, keeping eye contact, sit, shake a paw, just keeping their mind focused on you as opposed to everything that's happening around them that can be part of that anxiety. I also really encourage dogs to have non-medical vet visits. And what this means is just stop into your veterinarian clinic and say hi. Receptionists love to give treats to dogs, and they always have a jar at the front. So just tell them that you're just here to say hi, just trying to help with anxiety at the vet, and they'll be glad to help. So if you just pop in your vet on the way on a walk, you're great. There is also a spray that you can get for dogs that is a calming pheromone spray. So it is kind of, I guess, would be a little bit more natural way to help them. You can spray it on a bandana. They do carry it in vet clinics. I think they carry it in pet stores too. Or otherwise, specifically ask your veterinarian about your dog's specific needs for anxiety. Quickly about cats. If you leave the carrier out the night before and they're allowed to sort of investigate it and just get a sense of what it is, rather than you pull them out and you pop them in, it's a little less daunting for them. You can also tip the carrier on its kind of upward side as opposed to, you know, putting them in horizontally, just lower them in. Some clinics have fear-free or cat rooms specifically designed for keeping cats calm, and that's a good thing to ask your clinic. And then there is a calming pheromone spray for cats too called Feel Away, and it just kind of helps create nice, happy feelings. So those would be my recommendations about making a comfortable vet experience. And finally, just wellness, about how to keep our pets healthy. I broke it up into, like, dogs have their physical health and mental health just like we do. So both are very important at keeping our pets healthy. Obviously, physical health, exercise, keeping them, you know, not getting too heavy, but also that nice kind of fresh air does everyone some good. Keep up on the routine care, brushing their teeth and regular grooming. I've listed some things there you can talk to your veterinarian about specifically, but above are the things you can do from home. My favorite is the mental health. I think that we sometimes overlook, not always, but I mean, their mental health is just like ours, need lots of love, recognize, you know, let them feel like they're part of the family. Mental stimulation, especially for cats too, but definitely for dogs, is a big thing to keep them healthy. So some people sign them up for agility classes or even just doing regular tricks with them, obedience. Puzzles, dog puzzles, big fan. I think they're amazing. You can find them on Amazon. They're a really good way to keep your dog busy, and also socialization. So anytime, all dogs have a right to be out and on walks, but just recognize your dog's limits and doggy daycare, dog parks are not for everyone. Just make sure you're socializing them safely. And lastly, there are some, just like people, we can run into cognitive issues. Doggy Alzheimer's is a thing where they start to become a bit confused. They have anxiety just like we do. So talking to your veterinarian about those things to help keep them mentally healthy is a good thing.
Great. Thank you so much, Marie. Robin had one more question that I hope you can answer quickly. Is eating too much grass a bad thing? I just was doing a training session and the dog was eating tons of grass, but we're working on it.
So dogs eating grass is usually a sign that they're nauseous. So if they eat a ton of grass, there's usually reason behind it. The grass in itself isn't harmful, but you have to wonder why they've started eating grass. So just be on the lookout for any vomiting or diarrhea.
Okay, awesome.
Dr. Ashbourne, my dog has been eating lots of grass in the heat when she's running. Do they do it to drink too? Is that?
If it's kind of moist, yes, they could be doing that. And yes, there is a fair amount of water content in grass.
Okay, awesome. Awesome. Well, thank you so much. Thank you, everybody, for joining us. And a big thank you to Dr. Marie Ashbourne from the Stouffville Vet Clinic on all your expert advice and sharing this time with us. We really appreciate it.